They are the tip of the spear in the fight against COVID-19, and they are exhausted.
Don't know how they're doing it. Frontline nurses time and again putting their own lives on the line to treat COVID patients. And today, the nation's largest nurses union came out with a list of demands as they battle this second wave. Paula Tutman has their story.
A universal smackdown by nurses from National Nurses United, who shared their frontline horror stories from across the country today.
Unfortunately, our government and healthcare employers have not implemented what is needed since the pandemic started. And the Trump administration has explicitly stated it is not even trying to contain the virus.
Their claim that a general consensus of nurses are suffering through staffing shortages and their own fears of catching the virus.
Last week, I reached a point where I was numb. I didn't feel tired. I didn't feel happy. I didn't feel angry. I didn't feel frustrated. And I didn't feel sad. I literally felt nothing. And that is a scary place for a nurse to be. And I see it on my coworkers' faces. They're so tired of fighting that they don't have that much more to give.
They also say their patience has run out for those who believe COVID isn't real, it's just the flu, and all of the other deliberate and wanton choices to believe anything other than the proven scientific information about this killer pandemic.
What started as a sprint is now a marathon, and we are mentally and emotionally exhausted.
Christina Hansen is a registered nurse from Marquette, Michigan.
This takes an emotional toll that will stick with us for the rest of our lives. While we are all concerned about patient safety during this pandemic, we also worry about the safety of our families. We shoulder a level of concern and anxiety that we will contract this virus ourselves and spread it to our loved ones. Nurses are tough, but as strong and dedicated as our nurses are, what we are doing is not sustainable.
I mean, these nurses come to us from across the nation. They are painting their situation with a broad brush, but it is not to be ignored, because even though there's a great deal of suffering with COVID-19, understand the people caring for these patients are suffering too. Paula Tutman, Local 4.